is for education and entertainment purposes only. Please consult with your healthcare provider before making any changes to your health plan.
Hello, hello. Hello, everyone. Thanks for joining. I am just pinning the topic so you all can see what we are talking about. Thank you for joining. So our today's topic of conversation is self-advocacy in chronic illness, and we're going to be talking about lichen sclerosus especially. I'm just waiting for Jacqueline from the Lost Labia Chronicles, and start in a couple of minutes. There she is.
Hey!
Hi!
How are you doing?
Thank you so much for doing this again with me.
Oh, my pleasure.
Everyone who is joining, we actually did the same live about a month ago. I couldn't post this live, and I think it was so full of information, and Jacqueline shared so many nice nuggets that I thought it would be meaningful to do it again. So we have it on both of our pages, and so you guys can check it out later. So without further ado, let's first introduce ourselves. Jacqueline, please introduce yourself. Please tell us about yourself. Yeah.
So my name is Jacqueline. I am the founder of the Lost Labia Chronicles, which is essentially a content hub for lichen sclerosus information and support resources. I, of course, have lichen sclerosus myself. That's me.
Thank you for joining. And my name is Mukta Chauhan. I am a pelvic health physical therapist. I work in New York City. And I think it is just working in pelvic health for a number of years. I realize I see a lot of patients who go from doctor to doctor or provider to provider without getting any questions answered, or a lot of times they are getting treatment for something they don't really have. And I think that's one of the reasons why I wanted to start the series and kind of bring on different people who have either gone through their own journey or they have experienced in different ways, to kind of support people who are suffering from some kind of chronic illness and how they can advocate for themselves in such a tough medical system. So could you just, that's my first question, what prompted you and what was your reason to start the Lost Labia Chronicles?
Yeah, so my journey to getting my lichen sclerosus diagnosis was actually really, really long. It took me a little over 10 years to get diagnosed. And so initially what happened was in my early 20s, I started experiencing pain with sex. And at first it was just this kind of mild discomfort, and then that discomfort kind of grew in intensity and complexity over the years. So I would have burning and stinging pain. After a while, I started tearing during sex. So for folks that are watching the replay or on the call now and are not super familiar with the vulva, here we've got the clitoral prepuce, the glans, the labia minora, the labia majora, and then you got your kind of vaginal opening here and the perineum around here. So for me, what would happen was during sex, I would tear a lot around this area here, so around the opening of the vagina to like the perineum, and then I would also tear around the clitoral area. And so this is really distressing for me as a young kind of 20-year-old that had never really...
Sorry, Jacqueline. I think someone wrote, please write the word you're discussing. And I think let's not make it more scientific. So labia minora, labia majora is basically inner and outer lip of your vulva. So that's what we are discussing. And Jacqueline is explaining to us what she was experiencing. Sorry, Jacqueline.
Yeah, no, that's okay. No, thank you. Yeah, so this is kind of at the base where I would tear, and then up here around where the clitoris is, I would tear a lot during sex, and I never really understood why, and it was really painful and really distressing. And then, I kind of hopped around doctor to doctor because I was in graduate school, and so when you're in grad school, you tend to kind of move around, and you're never kind of seeing the same doctor twice. So I was kind of going to a lot of walk-in clinics, to STI clinics, And then to like the university that I was at had like a little clinic inside, but you never saw the same doctor. So I would always come in with, the same complaints, and they would always say, that's okay. This is totally normal. Welcome to being a woman. You clearly have a lot of anxiety, and I think if you just learn to calm down, that things will get better. But they didn't, of course. And so again, this pain is just getting worse and worse. And then around my early 30s, I started experiencing vulvar itch. And this itch was unlike any kind of yeast infection I had ever experienced. I mean, this itch wakes you up at night. It turns you into an insomniac. Nothing can stop it. And, I would treat with over-the-counter kind of yeast medications, and they would never work. Nothing could kind of get rid of that itch. And then the last thing that kind of, made it, finally get that diagnosis is that I started to fuse together. And I didn't realize that I was fusing. So what happened was I felt like my vulva was really sticky and tacky. And I thought, okay, well, it's summertime here in Toronto. It's really, really humid. And I assumed that the humidity caused that kind of sticking together feeling. So I was like, all right, I guess it's just that. Now looking back, I realized that what's actually happening was parts of my vulva were starting to actually stick and fuse together. And that is something that can happen with lichen sclerosus and something that was happening to me. So once I was done grad school, I moved to Toronto, and then I finally got an actual, family doctor, someone that I could consistently see and that would follow me. And I remember kind of talking to her, and I had went to a clinic called the Hassle-Free Clinic a week before I saw her about this vulvar issue because I was in so much pain during sex. I was like, I can't live like this. Like, something has to give. I don't understand this, but I can't. This is just too much. So I found this place called Hassle-Free Clinic, which is supposed to be like an STI kind of women's health kind of center. So I thought that would be a good place to go since they kind of focused on like the genitals. And I was told there, she examined me really quickly, the doctor, and again said, well, you look normal down there. You're fine. This could be multiple sclerosis, but I can't help you. Yeah. And I was like, oh.
Multiple sclerosis.
Uh-huh.
Wow.
Yes. Yeah. She said this could be multiple sclerosis. And I'm not sure what the connection was there other than multiple sclerosis. People with multiple sclerosis can have sexual dysfunction issues.
Mm-hmm.
So I don't know if that was her best guess. And you can't really see multiple sclerosis, right? It's a nervous system thing. Like, I have no idea, but it scared the crap out of me.
I bet.
And she didn't even give me resources. Like, she was just like, it could be multiple sclerosis, but I can't help you. Goodbye. So I was just kind of like, wow, you didn't even like refer me to a neurologist or something. Like,
wow.
You tell me I could have this big thing, but you can't help me and leave. Yeah, that's interesting, Michelle. I wonder if she messed up lichen sclerosis and multiple sclerosis.
Yeah.
I
was thinking about that. Like, they do sound very similar. So.
Right.
But even with that, like, let's say if she was confused with lichen sclerosis, like, I wouldn't just like say,
I can't help you.
I can't do anything.
Yeah, there's nothing I can do. And I did say that, my mother had multiple sclerosis. So that definitely like triggered fear inside me because multiple sclerosis is in my family. So then I was like, oh man, this is around the time that my mother was diagnosed. Could this maybe be multiple sclerosis? Like, I don't know. That's definitely a possibility. But I left feeling really defeated with respect to like the vulvar pain and the vulvar itch because I was like, well, it just seems that nobody can help me at this point. So I kind of gave up. I walked home and I thought, I'm just not going to have sex again, and I'm just going to have to learn to deal with the itch and the pain and the discomfort because this must be in my head at this point. Like, how can I have 20 plus doctors look at me and say that I am completely normal? And then so I went to my, I finally got my general physician and I went to see her for something completely unrelated. And I mentioned some of my symptoms and she kind of stopped me. She was like, hey, wait. Can we go back to the vulva stuff? And I said, yeah. So I explained the tearing and the itch and the pain and all of this. And she said, well, I understand that many doctors have told you nothing is wrong, but as your family doctor, as your general physician, I would like to look at you. I would like to say there's nothing wrong. So I said, okay, sure. So I went in the other room, took my pants off. She walked in and she looked at my vulva for 1 second before she said, you have lichen sclerosus. And I immediately was like, I'm sorry, what? And then at that point, she looked a little bit more in depth, she moved stuff and, got a better look. And she said, yeah, this is definitely lichen sclerosus. You have both signs and symptoms of lichen sclerosus. So my symptoms being, all the different types of pain and the tearing and this. But then the signs were that when she was examining my vulva, the whole vulva was white.
Yeah.
Like, it was white. There was areas of thickened white, areas. And then there was a lot of scarring, a lot of that fusing. So I had lost the labia minora. So those inner lips of the vulva, those were completely gone. They had just fused and stuck together to my labia majora, so the outer lip. So seeing both the signs and the symptoms, she felt very confident. And, I got referred to a gynecologist who now follows my case. But that's kind of how, I was diagnosed. And I have to say that the first year after being diagnosed was probably the hardest. I felt very alone. There's a lot of stigma surrounding, our genitals. So I kind of felt like I had nobody to talk to about it. And it was just really, really tough for me. But I think that ultimately, despite that being really hard, I did two things that I think really helped me in the long run. And that is I got a pelvic floor physical therapist right away, and I got a sex therapist. And my thought was I'll use the pelvic floor physical therapist to work on the kind of physical aspect of the pelvic floor, the vagina and the vulva. And then I'll have the sex therapist to kind of help me work through all of these mental health things that I've got going on right now surrounding my diagnosis and, pain.
I have a question about that, Jacqueline. This is actually very interesting. And if you could, I have two things. One, it would be great if you could just summarize a little bit about lichen sclerosus so people who are not familiar with it, they can understand. And then another thing is, this is really amazing that you thought of doing PT and sex therapy both, because a lot of times, first of all, people are not told about these other alternative, practices or allied, help that they can get. And another thing is people themselves, they don't really understand that they can actually ask for help. How did you come about it? How did you figure it out?
Yeah, no, those are great questions. So I'll answer the questions first, and then I'll give a little primer on lichen sclerosus. So I have degenerative disc disease in my lumbar spine, so just a very painful, back condition in the spine. So I'm no stranger to being in kind of rehab type facilities for this. And so I've been there for years, and I always noticed, I sit a lot in the waiting room, and they've got all their little biographies of the people that work in the clinic. And I would read, pelvic floor physical therapy. And I thought, oh, that's interesting. Something that I've never seen before. And again, spending a lot of time, I would read their bios, and I would read that, pelvic floor physical therapists could help with painful sex, trouble with urination, bowel issues, all of these things. And so I thought to myself, well, maybe if I have painful sex, I could go see a pelvic floor physical therapist and get assessed and see how they can fit into that picture. Because yes, I left with a prescription for medication, but I knew that for me, I'm a big proponent, and I know you are as well, of the biopsychosocial model, which is we don't just address the physical, we have to address the mental and the whole body, kind of mind, brain together. And so I thought, I'm going to go get a pelvic floor physical therapist to help me work through that. And I definitely do not regret that decision. I still have a pelvic floor physical therapist that I work with on and off. And that was really, really wonderful for me. So I think that's what kind of had me make that connection, because it was not mentioned to my doctor. And when we talk about tips for patient advocacy shortly, this is one of the things that I'll bring up, right? A lot of doctors won't mention this to us. Yeah. I don't think I've ever heard of anyone that told me that their doctor referred them to pelvic floor physical therapy for lichen sclerosus. Not once. They usually find out about it by reading my blog or reading somebody else's blog, or, you know, they hear it through the grapevine and then they think, oh, I wonder if that would be something for me. And then they talk to their doctor, but doctors don't usually, you know, mention it
Except
at
for
all.
except for like a number of bunch of doctors, but you're so right about that. And I think this is my biggest frustration, but it's not about that today. Today is not about that frustration. So we'll continue talking about lichen sclerosus. Yes.
Yeah, but I mean, I definitely share that frustration as well. So lichen sclerosus, for folks that are kind of unfamiliar with it, lichen sclerosus is a chronic inflammatory skin condition. It is considered to be an autoimmune disease. And what the kind of current science shows about lichen sclerosus is that what happens is that there's a protein or a collection of protein that lives in the basement layer of the vulvar skin. So I'm going to draw, and I don't know if it's going to come up well, but if you can see these lines, and just imagine there's 7. So then at the bottom here, you have this angry little protein here, and the body says, whoa, what is this? I don't know what this is. And when the body says there's something, you know, an invader or an intruder, they see it as a threat. So they want to eliminate it. So what the body does is it launches this mega inflammatory response to try and kill off that protein that's actually an organic part of our bodies and doesn't need to be attacked, but it attacks. And that inflammatory response creates a boatload of inflammation, like really an astronomical amount of inflammation. And that inflammation is responsible for the changes in the skin and all those upper layers. So that's what makes the skin more thickened. And because the skin is thickened, it's rigid and it's not as elastic. So it's more prone to tearing, it's more prone to itch and all of these other things. So symptoms include pain. That pain can vary. It can be generalized kind of vulvar pain. It can be stinging pain. It can be stabbing pain, burning. And then there's itch, and your itch can be mild to severe. It's all a spectrum. Same thing with the pain. You can have pain with sex. You might tear during sex. So there's a bunch of really ugly and awful symptoms that kind of fall into the itch and pain category. And then for signs of lichen sclerosus, you'll notice whitening. And that whitening can be like a general whitening of the vulva, or there can be like white patches of skin. Those patches will kind of tend to be very thick and kind of raised. And then there can be architectural changes, which just means that the way that your vulva used to look isn't how it looks now. So maybe you used to have, you know, prominent labia minora, which are those inner lips, and now they've kind of shrunk back and are sticking together. Or maybe your clitoral hood. So I have this, which is clitoral phimosis. So this is the clitoral glands, and then this navy, I guess, color is the clitoral prepuce. Now, in people without lichen sclerosus, you can kind of retract the hood to expose the glands. But for people with lichen sclerosus, there's this hardening and this thickening and this scarring that occurs, and it covers and kind of buries the clitoris so that you cannot really retract and pull back. Maybe you can just see a teeny little bit, but that's kind of it. And then, you know, that can cause a bunch of issues, because when you can't retract the clitoral hood, you can't clean properly. And when you can't clean properly, you can get something called keratin pearls, which are basically just dead skin and oil that ball up. And now because you can't retract, you can't really get those out. And so they kind of ball up under the hood, and they can be very, very painful for a lot of people. And then in addition, that scarring can also cause reduced sensation. So people will note, you know, hey, my orgasms are not as strong, or I feel like something's off with my clitoris. I don't feel the sensation that I kind of used to feel. And so just to kind of end that little summary, I just want to say that for folks listening, just because you don't have all the symptoms doesn't mean you don't have lichen sclerosus. And just because you don't have all the signs doesn't mean you don't have lichen sclerosus. You can actually be asymptomatic. So a lot of people go to the gynecologist and they get an exam, and the doctor goes, oh, you have lichen sclerosus. And they're completely caught off guard because they have no pain, no itching, sex is easy. So they don't understand. They're like, what do you mean? And then they show them that their vulva is thickened white plaques everywhere, and they're really taken aback. So it can present differently in different folks. So I think that's something that I do like to emphasize. I think some people think that you have to like kind of tick every single box, but that's not necessarily the case. So
yeah, and also I think it's important to understand that like just getting the diagnosis doesn't mean that, you know, it's doom, or, you know, you're not going to
yes.
have meaningful relationships, or, you know, enjoyable sex and all those things. And of course there is treatment available as well. And that's what we are trying to talk about. And I think the next topic is basically tips for, you know, I'm hearing myself again. I don't know what's going on here.
You're hearing what?
There is an echo.
Okay. I don't hear the echo on my end. So we will see. I think you're okay.
Okay, great.
Yeah.
Since it's my recording, so I don't know how this is going to turn out to be, but hopefully it's going to be okay. So again, to like emphasize that it doesn't mean that if you have the diagnosis, or if you are suspecting lichen sclerosus, you have to think of the worst possible scenario. There is definitely help available, lots of you know, medical treatment, physical therapy, sex therapy, as Jasmine has mentioned.
Yeah.
Next, I think I'm just going to segue into what are some of the tips that you want to give people who have lichen sclerosus right now, or they might be suspecting that they. What would you say?
Yeah, so the first thing I would say is to know your anatomy and to use the correct terms when you're talking to healthcare providers about, you know, whatever issue you've got going on. So it is totally cool if you've got a cute little nickname for your vulva that you like to call her with all of your friends. But when you're talking to a healthcare provider, it can really be helpful to use the proper terms. And I say this because I mentioned that it took me 10 years to get diagnosed. And I think that what really held back that diagnosis, or delayed my diagnosis, was the fact that I wasn't using the correct terms. So I kept going to all of those doctors that I mentioned. I kept telling them, you know, my vagina hurts. My vagina hurts with sex. My vagina, my vagina, my vagina. And so, of course, again, coming back to this little vulva model, the vagina is the inside. My issue was the outside, but because I kept referring to a part of me that was inside, they would spend the focus of their time looking inside and not spending much time on the vulva. And so, you know, I definitely think sometimes in hindsight, had I said, you know, my vulva hurts instead of my vagina hurts, I wonder if that would have clued people in better, or maybe they would have thought, let's send her to a vulvar specialist instead of, you know, a gynecologist.
Although I still think that, you know, it is somehow providers' responsibility to see things around. But I see your point. And, you know, I have, you know, it's almost like, you know, if someone comes to me and they say hip hurts, it's not that I am just looking at the hip. I'm looking at the back as well, their feet, and, you know, so you have to do a proper assessment. But I do also understand that in our current medical system, the doctor may have only 2 minutes, and that's why the communication and how you're representing your symptoms and what you're saying becomes so important, you know, to just make the most of those 2 minutes.
Yeah, and I think what you're saying kind of points to the fact that we're talking about like an ideal system and the system that we're currently working in. Because in the ideal system, I wouldn't need to tell you this. You could call your parts whatever you want, because the onus would be on the practitioner to do a thorough assessment, to ask the right questions, to kind of pull out that information. But unfortunately, like you said, we're not in that ideal medical system. And so this advice is really, again, you know, for folks that, yeah, they get 2 minutes in the office and they just gotta, so for me, you got 2 minutes, we're going to be as precise and sharp as we can. And so I wish that I didn't have to give this advice, but unfortunately.
I just want to add one more thing because the bias plays such a huge role, you know, in these situations. If you have had a diagnosis and, you know, you are happy with the treatment, you know, plan, perfect. But if there is a suspicion or you're not absolutely sure, I wouldn't go to another provider and say that's what I have. I would let them, like, I would describe my symptoms. Right, yes. And not give them the label on a platter, because when they're mind is going to be very limited to only that condition, and they're not going to look at the other thing.
I agree with that. Yes, 100%. And so instead of saying, you know, coming in and being like, I have lichen sclerosus, or I think I have lichen sclerosus, or whatever else you suspect that that you might have, the next point is to talk about your symptoms, but use adjectives to describe your symptoms. So don't just say, for example, I have pain in the vulva. Say, it feels like there's a searing hot knife being stabbed into the vestibule, or there's a dull fullness in the vulva that I feel. It feels really achy and heavy, or I feel really sharp, or it feels like I've got paper cuts and someone poured rubbing alcohol. So really be descriptive and use those adjectives to really paint them a very clear picture, because pain is complicated. Pain is so complicated. And then to try and tease out what we're working with is hard. But those adjectives can give clues to providers about what type of pain can be going on. So I always say to be super descriptive and use adjectives. And then kind of building on that, to describe your symptoms in terms of function. So explain to them the symptoms and how they impact your quality of life. And if you can do that in a way that's also quantitative, even better. So some examples of that would be, you know, I haven't had sex in 3 years. So that's your quantitative piece there. You're telling them how long it's been impacting your quality of life because of that searing knife in the vestibule pain. Or you might say, I've had to take the last 3 weeks off of work because the pain in my perineum is so sharp and so raw that I can't sit at my desk. So now you're really showing how it's impacting your quality of life by showing that you can't show up to work or you can't function sexually. You want to really, again, we're trying to paint, you know, the best, most clear picture possible so that they really understand where you're coming from and kind of what's at stake.
Right, yeah.
And then after that, I would say a big thing that I recommend doing is to come in with a kind of documentation of your history and a kind of timeline of when things started and how they progressed, as well as kind of a symptom tracker or something that kind of has tracked your symptoms. And so, you know, how you kind of do this is to each their own. I usually just draw my timeline out by hand, and I'll put like when things first started, any relevant incidents. So like with trigeminal neuralgia, I would put, you know, that I had this dental trauma that happened. And, you know, so you kind of piece that all together. And then if you can also have like a kind of symptom tracker where, you know, it's just this big thing of data, which might look just like a mess of data to you, but that mess of data contains clues for the healthcare practitioner, and they're seeing it through a different lens, and they can kind of parse through that data to kind of get a better understanding of what can be going on here or what might not be going on here. And I think this can be helpful for two reasons. One, our memories aren't perfect. Some of us have great memories, but our memories are imperfect, and we might get some certain timelines jumbled up. And sometimes those timelines really matter with respect to getting a diagnosis. And kind of building on that, if you're an anxious person, like I'm a super anxious person. So when I get anxious in a doctor's office, my head goes blank. I cannot remember when it started. I don't remember when it got better. I don't remember when I switched my medication. I can't remember that offhand. So to have that kind of on a paper that I can give to them, it really helps eliminate those kind of memory issues and those issues that I at least have with anxiety and communication.
Yeah. And I think it's an objective way before, you know, just like how you're saying, if you're feeling for any reason anxious or emotional, you know, there could be, it's just not easy to kind of keep the information very streamlined. So if you speak before going into the office, I think that can be very beneficial for both the provider and you.
Yeah, and it's a time saver too. If you think again with the ideal world or the ideal medical system and the system that we're currently in, the system we're currently in makes it such that most people don't get that much time. So if you can save time by already having this information, handing it to them, then we've got more time to address your questions and concerns. So that again can be a nice little add-on.
Yeah, not to, people think a lot of times that this is not relevant. Like if I had some inflammation on my cheek, it doesn't make any sense to talk about it when I'm talking about my vulva. But again, like there could be several things that might be happening, could be indicating to an underlying autoimmune condition, inflammatory process. So it's important to like give the entire information to your doctor. Please don't decide on yourself whether it's relevant or not to your space.
Yeah, I always I love that. And I always say, like, it's on you to figure out if you care about this or if this matters in the grand scheme of what I'm saying. It's not on me to know that information. I'd rather give you too much than too little, because you give them too much, they can parse through that and decide what's relevant and what's not.
Yeah.
So yeah, definitely. Another thing I always suggest to folks is to bring paper and a pen to the office to kind of take notes. In any kind of doctor situation, you're going to get a lot of information thrown at you, and it can be really overwhelming to, again, remember everything. It's new information, and I think there's a statistic that I never remember, but it's like when we're presented with new information, we only retain about like 20% of it or something. It's really small. I don't remember the percentage, but it's really small, which means they're giving you important information about your health that is going to be gone by the time you get home. So take notes. And if taking notes isn't accessible to you, ask the provider if you can record the session. And you might want to add, is it okay if I record? And here's why. I have really bad anxiety and I tend to forget, or I have this accessibility issue that makes it such that, I need this kind of aid. And these can be, good ways so that you can hold on to that information and go back to it. Alternatively, you can bring in somebody with you, like a friend, an advocate, somebody like that. I know this can be tricky depending on where you live in the world and depending on like what COVID protocols are. I know for like the last 2 years, at least in Canada, nobody could come in but you. So that's why I would really stress like the notes and the recording. But if you can get somebody else in the room with you, that can also be really helpful, because they can be a second set of ears to kind of listen and help remember things, and also ask questions and help you advocate for yourself if the doctor is kind of pushing back a little, which unfortunately can sometimes happen. And when you're in that position, you're so vulnerable and so scared that it can be really hard to speak up for yourself. That's definitely happened to me a lot. And so it can help if you have someone in there that can kind of push back for you and be like, hey, that's not okay. Don't speak to her like that, please, whatever the issue is, to kind of advocate for you. So pen and paper, or ask if you can record, or if it's available to you, bring in somebody, to help advocate and to help listen and remember. And then I'll just give more precise tips to 3 different scenarios. So the first scenario is you're in the doctor's office and they say, yes, you have lichen sclerosus. Whether they're confirming with a biopsy or a clinical examination, they've told you you have lichen sclerosus. Ask them to first explain what lichen sclerosus is and what your prognosis is. Then, when they talk about treatment, ask them, what are my treatment options? And when asking that, you want them to describe or explain the risks and the benefits of the treatment options that they are listing for you. Now, typically, doctors will just standardly say steroids. That's it. But there are other treatments like calcineurin inhibitors and other things that, could be adjunct that are not mentioned. So you might want to have that conversation and see if they can talk you through the pros and kind of cons of each of these treatments, so that you have that information and you can kind of go home and dig around a little bit more and find a treatment plan that really works for you and your body. And the last piece of advice that I suggest when you've been told that you have lichen sclerosus, and this kind of ties back to what we were saying earlier with pelvic floor physical therapy, is to ask them for any relevant referrals. Ask them for mental health support. If your lichen sclerosus involves a pain component, ask them to be referred to a pain clinic, a pain counselor, or something like that, a specialized individual or group that can help you manage the mental health side of dealing with chronic pain. if you foresee, depression and grief, ask them for, a referral to a therapist. And then ask them on the spot to give you a referral to pelvic floor physical therapy, because I know, Mukta, that we have spoken about this many times, and I always say, like, I wish that everybody that got diagnosed with lichen sclerosus was given a referral to pelvic floor physical therapy, because most of us have gone years in pain and with a lot of tension, and this can cause the muscles to really tighten, and you can, get, hypertonic pelvic floor dysfunction and all of these other things that pelvic floor physical therapists can assess and help you work with. And there's a lot of other, things that can happen to folks with lichen sclerosus, like painful sex, difficulty urinating, difficulty having a bowel movement. And these are all things that pelvic floor physical therapists are excellent at working with. And these are things that just putting on a steroid won't do.
Yeah.
So, I obviously use my steroid, and I'm all for that, but we also have to address those other components, because it's not just swiping a cream on the vulvar tissue. So before you leave, ask them to refer you to pelvic floor physical therapy, and ask them for mental health kind of support resources.
These are
we need them.
Great points. Thank you for, that was super helpful. And I think I really liked the recording thing as well. And actually, I do that for my patients quite a lot. I was like, do you have a smartphone? Can I just record all these instructions? And I think it's easy as well, because I have given them very precise instructions. So next time when we meet, I am hoping for some improvement, or like there is no scope of confusion I want to leave. And I think that's really important.
Yeah, it definitely clears up confusion.
Yeah. And it's so important that you brought this on as well. Like, a lot of times it's like, oh, so it's not a vagina problem, it's a vulvar problem. So why do I need a pelvic floor PT? How is my pelvic floor getting affected by it? So it's just like, it's a very simple, like, if you're experiencing pain in any part of your body, the muscles, the neighboring muscles are going to get spasm or go into spasm, or protective guarding, as we call it. And we know the importance of pelvic floor muscles as they, support your bladder, bowel, and sexual function. So anything, if it's happening there, it doesn't even have to stop there. But anything, even infection, like sometimes I've seen people with just recurrent infection, and they would get pelvic floor dysfunction from those. How is infection affecting the pelvic floor muscles? It's the protective guarding. So we really need to kind of teach these muscles to have a good motor control. And in some cases, you may need only 1 or 2 sessions just to learn what you're supposed to do with those muscles, and you'll never need to see the PT again. And for some people, it may be a recurrent thing, checking every now and then, a more regular PT visit.
Yeah, and I think like it can't hurt to just at least go in and get assessed.
Absolutely. Absolutely.
Best case scenario, the pelvic floor physical therapist says you have the most perfect pelvic floor muscles and everything is excellent and you are good. Then you have peace of mind that your pelvic floor is good and you can just kind of move on. But sorry, I got distracted by the question. I have so many pelvic floor questions and problems. Just
DM us.
Never had. Yeah, DM us.
DM us.
But yeah, and like you said, it could be just a couple of sessions. It might be multiple. You might kind of like me go for 6 sessions and then kind of go back periodically. And it's interesting because I just saw my pelvic floor PT a few weeks ago who's showing me how to do a technique called clitoral myofascial release, which for folks is essentially just kind of moving the clitoris and stretching the clitoris to try and break up some of that scar tissue and bring back more elasticity to the area. And on the topic of recording, she was showing me all of these techniques. She was doing that on me, and then she had her little pelvic floor model and she was doing it with a Q-tip on that. And I'm sitting there thinking, I'm not going to remember this. So I just asked her straight up, I was like, okay, can I record this?
Thank goodness smartphones, right?
Honestly, because then I have the model. And I'm a visual learner, and this is also where it matters. For visual learners, just hearing the oral instructions or the written instructions won't be enough. They really need to see. And physical therapists are great for that because they have all types of, props to kind of show you what you're working with. And then I just filmed her little live demos And for the first week that I was doing it on myself, I would literally just watch back the video and be like, okay, yep, okay. So that can be really, really helpful. And I'm glad that I asked her for that.
Great point.
I was like, I didn't know if that siren was yours or mine.
Oh, this is here.
I mean, New York or Toronto, it could be either or.
So we talked about some of the tips about that. Do you have any tips for providers?
I do. But I just want to walk through two more scenarios if we have time. I'll go through these ones quickly. So the first one was if you get diagnosed with lichen sclerosus. The second is you go in with vulvar issues and they tell you, I don't know what's wrong. Like I was told many times, like most people get told many times because chronic conditions typically take years to get a diagnosis. So if they say, I don't know what's wrong, then ask them, what else could be causing my symptoms? And what kind of tests can we do to rule those out or to make a confirmation? Now, if they don't know or they're not willing to do further tests or investigations, get a second opinion and or ask them to be referred to a vulvar specialist. Mm-hmm. So if your gynecologist or dermatologist is like, nah, you look fine, I don't know, tell them I want to see a vulvar specialist and ask for that referral. And then before you leave, ask them, what can I do to manage these symptoms in the interim? Because while they might tell you that there's nothing wrong, you still have to suffer with those symptoms. So you want to know, like, what can I do to alleviate the itch? What can I do to relieve some of the pain? So ask those questions. And then the third scenario is they tell you, this might be lichen sclerosus, we want to do a biopsy. So for the biopsy, they might decide to say, we'll do it on the spot, or they might say, come back in a couple of weeks. So I'm not going to go over all of my tips for this because I have a very extensive blog and YouTube video on this. You can find me in the link of my bio. You can go check that out. And I talk about a bunch of tips to do before, during, and after a vulvar biopsy to help make that process as comfortable as something like that can be.
Maybe I can link that. If you can send me a link, I'll connect to the live.
Yeah, I'll do that, or I'll comment on the post, and then you can kind of pin that there with those resources, because there's a lot of really good tips in there for kind of how to manage that.
Great.
So those are the three main, kind of scenarios that you walk through, and at the end of the day, always, always, always do something nice for yourself afterwards. Some self-care. These appointments can be very stressful and very difficult on us, So even if that just means going out for a coffee with a friend after, watching a nice movie, picking yourself up a bouquet of flowers, or just do something nice, because this is hard. It is tough work to advocate for yourself in a medical system that often just shuts you down and that doesn't give you enough time to be heard. So do something nice for yourself is my final little suggestion for the piece on advocacy for patients.
Yeah. This is great. This is, and actually, I just want to add a little anecdote about that. A patient of mine, we're very she's been my patient for a very long time, and just recently she told me that, what I do. We actually walked out of the clinic at the same time because she was my last patient that day, and she's like, every time I come here, I go to and have fried chicken here after our session, because this is I just want comfort food right after pelvic PT. And it was kind of like I had some kind of an aha moment. I was like, oh my God, I never realized, because we have such a rapport and, she feels comfortable, but I didn't realize that still it could be so stressful for people. Mm-hmm. And this is something which providers should always remember no matter what. So that was a little lesson for me there too. That no matter how much you are trying to comfort a patient, it is still difficult for them.
Absolutely.
Yeah. So can we just talk about now the tips for the providers?
Of course we can, yes. So my first tip for providers is the most obvious tip in the world, and it kind of seems like, why is she even bringing this up? But I'm bringing it up because most doctors don't do it. and that is listen to the patient. Really listen. Try and not interrupt us. Try to not interject in all of these things, but really hear us as human beings who are sitting there suffering. And Dr. Corey Babb had done a whole series on medical gaslighting on his Instagram page, and that's now up on YouTube. And this was a point that he too was stressing for providers, was we really have to think about how we listen to patients, active versus passive listening, and, believe us, trust us. I know that you can't see the pain, but when I tell you I'm in pain, I am. I'm not making this up. So really just listen and believe and hear your patients, truly hear them as human beings would be, the first one. Yeah. The second advice is that, yes, lichen sclerosus, as you mentioned, is something that can be very well managed. Once you get on a proper treatment plan and you've got your team set up and, it can be managed. And I think sometimes providers think that because it's a, quote, manageable disease, that it's no big deal. And I wish the providers would realize how absolutely earth-shattering this disease can be to many of us, especially in the beginning when we're told you have lichen sclerosus, it causes painful sex, there's a risk of vulvar cancer. Like, I understand that you might see multiple people a day with lichen sclerosus, and for you, it's not really that big of a deal anymore. But for me, it is, and I wish that they would kind of remember that this is hard. Even though it's manageable, doesn't mean that we can't suffer. And on that note, check in with us. Yeah. Check in with our sexual health and our mental health, because our follow-ups are usually a clinical exam where the doctor is looking at the vulva to make sure that signs haven't progressed and that everything still looks good and that you're on track to kind of getting into remission. And that's normally what a follow-up looks like. But I wish that healthcare providers would spend a couple extra minutes checking in and saying, how is your sexual health? Are you able to have sex? Does it hurt? Are you intimate in other ways? Stuff like that. And when you have that conversation with the patient, you might be able to identify there might be something that you can do to help, to prescribe, to, that. Or you might be able to say, I think sex therapy might be a good option for you, and kind of write a referral. Same thing with the mental health. Check in with your patients, not just how are you symptom-wise, but how are you doing up here? How are you doing with that? And, you might find that patient, while smiling on the table, is completely absorbed in grief and depression. And if they confide in you, give them resources. So, remember that just because it's manageable doesn't mean it's not difficult and hard for us. And check in with us. Check in with our mental health and our sexual health, along with, the kind of physical vulva piece. And then the last thing that I would say is to educate yourselves, because medicine is a field that is constantly evolving, and sometimes it evolves really, really quickly. So if you're relying on information that you learned in medical school, that information might be completely outdated. And then when you're talking to your patient and counseling them, you're counseling them based on outdated information. And in some cases, that can actually cause a lot of harm mentally and physically to the patient. And so if you're not sure where to start, seek out the experts in the field and ask them for resources, like go to the Center for Vulvovaginal Disorders and talk with them and say, I'm a gynecologist. I want to learn more about lichen sclerosus so I can better support my patients. What are some good papers to kind of start with and learn, and make a commitment to stay up to date on the literature, because again, the literature is always changing. So, be open. And I know that involves some kind of checking of your ego, because now you have to acknowledge that your knowledge isn't, all seeing and perfect, and that we all need to constantly learn and unlearn and rework ourselves. And
it's science. It has to be, if
I know
our information was completely perfect, we were still believing that Earth is flat, right? We would have never come to believing that it could be spherical too. Yeah. So
exactly.
It's really important. And I think I want to just name certain organizations and institutes that are doing such a great work. So ISWISH is really great in US, the International Continence Society, International Pelvic Pain Society. These are some of the places where you can join, attend the conference, talk to like-minded people, learn from the experts in the field. And it goes we're not just talking about specifically physicians, but we are talking about providers, any provider, physical therapists, because PTs could be very, narrow in their focus as well, and just keep on doing myofascial release or just like very specific work rather than looking at the body as a whole. So it takes a lot of practice and learning different kinds of skills to offer our patients a full 360-degree kind of a treatment. So it's important to kind of keep ourselves updated.
Yeah, I love that piece about, it's not just gynecologists and dermatologists, it's family doctors and nurses and pelvic floor PTs. I actually know of 3 separate individuals that were diagnosed with lichen sclerosus by their pelvic floor physical therapist. They were in there and the pelvic floor physical therapist noticed the scarring and the whiteness. Now, obviously they can't give an actual diagnosis, but they told the patient, I think you have lichen sclerosus and I think you need to go see a dermatologist or gynecologist and tell them this. And then they got their confirmation, so it's just, if more PTs are knowledgeable, if more general family doctors are knowledgeable, then we can catch things early. And then just kind of bringing this all back to what you were saying in the beginning, this is very manageable, but a big piece of it being manageable is catching it early and not letting people go 10, 15, 20 years where it's progressing. We catch it early, you can prevent a lot of this stuff from going on. So, yeah, I love that.
Yeah, this has been great, Jacqueline. Any concluding thoughts for this live?
Yeah, if there are any folks listening now or listening to the replay that have lichen sclerosus, think they have lichen sclerosus, and are looking for support, there is Lichen Sclerosus Support Network that you can check out. Myself and Kathy, the host of Lichen Sclerosus podcast, we host bi-weekly virtual meetups. We have 2 sessions that folks can join. We give a little bit of education, and it's also a space for folks to share and kind of connect and build community and learn from each other. So that can be a really nice support haven for folks to kind of find. And then I also now offer one-on-one lichen sclerosus peer support calls. So really quickly, I obviously am not a doctor and I cannot give medical advice, and I'm not a psychologist and I cannot replace a therapist. Other than that, happy to talk about general lichen sclerosus stuff. We can go through appointment prep, advocacy prep. I'm really passionate about talking about sexual health and mental health. So all aspects of, intimacy is fair game with respect to mental health, grief, body dysmorphia, depression, confusion, health anxiety is a really big one. So we can kind of talk through things. And again, just bringing it back, having a support group or a support community or even a support person can be really helpful when navigating the healthcare system, especially in the beginning when you're having that, difficult time advocating for yourself. It can be helpful to kind of bounce off of other people, here are my questions for my doctors. What do you guys think? And then we can all kind of collaborate together and be like, oh, don't forget to ask this and don't forget to mention that, and kind of work together so that you can get the best care possible. And then I did see some questions in the chat, so I did just want to close by letting folks know that you can always DM me here on Instagram. I'm pretty active here, so you can DM me or you can email me at jacqueline@losslabia.com. And thank you so much for having me back on.
Thank you. Thank you so
fingers
much.
Crossed.
This was great. Yeah. And fingers crossed I'm able to post this.
Yes. Well, thank you so much.
Thank you, Jacqueline. And it was again such a pleasure to have you here. And you just gave so much information. And that's the reason why I wanted to have this again. So, all right. Thank you. And Thank you everyone who joined today, and have a wonderful day.
Bye.
Bye.